Okay then, so welcome to the safety and wellbeing session. Quick one about me, I'm sure you've seen me around, but my name's Babs, so I'm in the military. I'm with the Royal Engineers Reserves as it is now. I did my full service with the military before that, but as a medic, and then saw the light and came across to the engineers as a reserve, and also done civilian life as well. So I'm sort of chairing the event. Obviously take you over to now our three chaps who can't wait to be at the front. So we've got Nathan, Mark and Matthew, and first up is going to be Nathan, who's also had military service.
I have for my sins.
Yes, I did stalk you all. So yeah, so I'll hand you over to Nathan.
Thank you. Well, I don't quite know where.
Oh, right, okay, so just, yeah, we've got Nathan on, so if anybody wants to sort of tap into the QR code, any questions, we will have the Slido at the end, so any questions we'll put onto the Slido and use those at the end, although I think we were sort of saying that main questions you wanted to be after the whole of the three sessions, didn't you? So we'll see how we get on with that.
So ideally, we'll rattle through, don't worry about it too much. The aspiration, particularly with a relatively small group, is let's have a conversation. This isn't the world according to us three, because quite frankly, we only know a little bit of our world. We don't know your world. So please do usual score. You know where commit is. IOM. So we've called it health, wealth and happiness for the reality that what we're trying to do is get us to start to think about linking our people with the reality of the money in the business. Because we don't. We treat them as assets, and yet we don't look after them particularly well. And what I want to do is explore a whole bunch of facts and figures. All of it is publicly available, but I want to try and provide a little bit of depth based on over 50 years worth of deep scientific research into occupational health. So IOM, Institute of Occupational Medicine, was founded in 1969 as a department in the National Coal Board, trying to find out why miners were dying of lung disease. Nearly 60 years on, we know why they were dying. We found the solutions, and those solutions have been implemented, and the mining sector in particular is far healthier than it was 60 years ago. Might not be safe in other aspects, but it's definitely healthier than it was before. And we see that across the whole piece. So I had teams, particularly through COVID, working exceptionally hard to work out how we could do it. I had one particular scientist who was furious that COVID-19 happened because he'd been doing the research when SARS-2 had happened, and because it didn't come out any further than Southeast Asia, all of the money got taken away. He was 3 months away from fundamentally with a team solving the problem. It needn't have happened if we'd have invested well. And investment is a key component to how we deal with it. So some facts and figures, just to start to bring it to life. We lose all of that time, all of that money every year because of ill health in the workplace, across all sectors. In construction alone, we kill, and I use that phrase advisedly, 6,000 people every year through long-term ill health issues, cancers, heart disease, and the like. 6,000. How many people died falling from height or in an accident in construction in 2022, 2023? There were deaths, they were tragic. There were 19 deaths falling from height. 6,000 people, 4,000 of which died through occupational cancer. And yet we talk about our 19 people rightly and say, what did we learn? What can we do to make sure that next year it's not 90? How often in your workplace do you talk about the 4,000 people who've died of cancer? And it's normally not enough. And the numbers suggest that it's not enough. So there are some really big numbers. These are from the HSE. So it's not that they're hidden. They're absolutely published. And they have got a depth of research behind them that means that you can prove them. It costs a lot of money. And then you see all this stuff in the news. So do you really understand what your people are being exposed to? And actually, do they? And that's not just at work, it's at home. Health is a continuum. That's a bit of a crass phrase. But things that are happening at home impact how you behave at work, and vice versa. So if you are one of these poor people who is living in a dreadful, damp house full of all kinds of horrid stuff, and you then have a respiratory problem, which you then go to work and in construction on site, you're then having to do physical activity, which you can't do because you're coughing and spluttering, there is a direct impact on your productivity because you can't do as much as if you were fit and healthy. And yet, how many of us, and I know there's a big brother meddling part here, but how many of us actually look and take the time to find out what's going on in our people's lives that means that things might not be right? 85%, and this figure was revised in 2022, middle of 2022, 85% of your workforce is worried about money. 85%. Of that 85%, sorry, that 85% is 50% less productive than their colleagues who are not worried about money. So you do the maths, and you've got about 40% of your workforce missing every day, even if they're physically present, because they're just not focused on the job in hand. We know they have more accidents when they're not focused at one end, but actually the stress and strain of life, of worrying about where the next meal is coming from, is having a direct impact on your project and on your business. And therefore, that's affecting your profitability. I've been involved with construction for a long time, and I find it quite fascinating that we talk about being a low margin sector. I get it. 0.9% is pretty poor. But then when you couple on top of that we're not very good at managing our resources particularly well, let alone our people and our time, and we waste and re-pour concrete. Have a look at the Get It Right initiative. Not health related, but it impacts. Get It Right initiative did some work, it was done with the Institution of Civil Engineers about 5-6 years ago, and they can prove that in an infrastructure sector of £110 billion spent a year, we waste £21 billion a year, fundamentally re-pouring concrete. So don't tell me that we're a low margin sector. Tell me that we're not being efficient and effective with our design and managing our people who crazily wants to pour £21 billion of extra concrete. Look at the stress and strain it puts on you physically. Look at the stress and strain it puts on you on a project. When you pour it wrong, you're now behind, so you've now got to dig it up. You're on site for longer, so you now can't pick the kids up from school. You've now got to ring your better half and say, can you ditch your work, because I can't ditch it because I'm currently pouring 20,000 cubic metres of concrete again. Look at the impact of how we behave as a sector on our people, and you'll see there's an interrelationship. And the interrelationship every day gets proved more and more and more. And I've alluded to this concept of our people and our expectation. So we did a piece of work in 2020, technology driven, about always being on. You've all got your phones. How many of you are constantly checking your phones? We all are. Whether we'd like to admit it or not, we are. Whether you're checking for work or for home. So as an example, I was just telling Matt, I run my local cricket team, my junior section. We've got a game tonight. I've had to call the game off at our field because it's too wet after the rain we had yesterday. So what? Why are you telling me this? Because the opposition said, well, shall we play anyway? We'll do it at our place. I've told my lot I've called it off, so I've now got to put it back up. The chaos. I spent 40 minutes of lunchtime on my phone walking something out that's got nothing to do with work. Does it mean I'm focused on my job at hand? No. Does it mean I'm now going to be on the train going home, going through my phone, trying to work everything out? Yes. How many of you sit at home and in front of the telly, if you get the chance to even sit in front of the telly, or sorting out tomorrow and the kids' school bags, or sorting out the job that you need to do because you've got that bill to pay and you've got to talk to that bank because they've messed that up, and you're on your phone. So always being on is a real problem. Again, look at where people are and help your people to manage their spaces. How many of you have the luxury of working from home? How many of you have the real luxury of having a study or a space where you've got your stuff? How many of you shut the door and switch the computer off and put your computer away at the end of the day? Brilliant.
Didn't say that.
Lots of people don't. What lots of people do is it's almost a kitchen table model. They've got their laptop on the kitchen table. They think they've switched it off because they're not looking at it. They've made tea, they've sorted all the bits and pieces out. They walk past and go, oh, I'll just check my emails. You're back on. Your mental health is being affected by not switching off. And when you speak to Matt, he'll tell you how we can track it, we can help you get prompted to behave better. So it's really clear, though, that we've got to set the expectation better in our organisations. So we can link it to practicality and productivity, but we can also link it sensibly to actually leading a cleaner, better life. Now, interestingly, there's tons of evidence that tells you that actually as employers, we're pretty poor at supporting people. Now, that's not to say there's not loads of guidance and direction. There's tons of it. The HSE is a really powerful source of information, as are people like IOSH, the professional bodies in the space, really good at saying, if you've got somebody with this issue, here are some tools to help you manage it. However, we live in a data-rich world. Note the word data. It's not necessarily intelligence. You've got to do some analysis of that data to understand what it means. And it's really important and it's really clear that we can link the overburden of analysis, because I just dump data on you. This is what stuff says. So what does it mean? I've now got extra stress, got to go try and work something out that's not my ballpark. I don't understand it. So there's a real good piece that really helps you to understand what is going on around you that you might not necessarily have seen in the first place. And when you look then at the wider guidance and the policies that you've got in your businesses, have a think about how useful they are. Because invariably they're really well written. But they don't complement each other. I'll give you an example. An engineering consultancy in our space, no names, no pack drill, but you will all recognise, I hope, some of this, because I did in an organisation I worked in. They had two different policies with regarding the management of their people who were on long-term leave, whether it was for maternity or paternity or long-term caring for somebody else. They were out of the business for a while. And there was a really strong policy about keeping in touch and how we would manage you well and effectively, and we'd support you on one side. On the other side, the operational part of the business that controlled the budget for their phone, computer and car said, I'm being billed for that, I'm taking those off you. So all of a sudden, I've got a policy at one end saying, you're great, we'll look after you, we love you. And at the other end, I've got a policy saying, you've not used your phone in 3 weeks, we're taking it off you. So your mechanism of keeping in touch, I've taken away. The social impact of being excluded is significant, and there's loads of data showing how the negative impact of being excluded hugely affects your productivity as well as your own personal well-being. But then on top of that, we've taken away all of the other simple mechanisms and tools we've got in place so you can talk to each other. And actually, it comes down from an occupational safety and health perspective about understanding the hierarchy of needs. Because, and COVID is a brilliant example of this. We all can talk about PPE till we're blue in the face. We all, through COVID, wore face coverings. That was partly IOM's fault because the World Health Organization at the beginning didn't suggest we wore face coverings. And we, with another 30 organizations who researched this stuff, said, no, you need to wear a face covering. This is an airborne issue. This takes you back to my person who was doing SARS-2, who knew exactly what was going on. But what's really interesting about the hierarchy of control is we don't start at the top. We start with the stuff that's easy to procure. I can buy some PPE. Whether it's dodgy, whether it's been made very well is not really the issue. Have I ticked a box? Yes or no? Tick. Actually, admin controls, we've just talked about policies and procedures. They're all there. The issue with policies and procedures is they've got to be used, and then we've got to, I'll use the word advisedly, enforce their use. And that's not in a draconian sense, but that's in a real sense that says we've got it, let's use it because it works. The piece where it then starts to become expensive is the place where we can add the greatest value without staying out of the way. So elimination is relatively easy. It's what happened at the beginning of COVID, isn't it? We're not going out, people, whether you like it or not. We don't understand, stay away. Really effective in terms of hazard exposure control, not very effective in making sure that the world continues to turn. Substitution is all well and good. The military use substitution a lot. Do I need to go to war to practice going to war? No, I'll just simulate a war. That's what an exercise is. That's what using virtual reality and augmented reality helps do. You can't do that when you're trying to get the stuff done in the end. So you can't always use substitution, but you can put engineering controls into place. But it's expensive. Can you effectively manage airflow? Yes. So in a building like this, there is an air conditioning unit. There's a ventilation system. I can guarantee that that system will not have been cleaned properly since the building was built. I can guarantee it. That's how confident I am. I can tell you though that you can almost measure and monitor it easily. And it's actually fairly easy to look after. Think about how it gets designed. The number of places who have a problem with poor ventilation. I'll take an extreme example, nightclubs. Nightclubs have an exposure problem with stuff. Invariably because you've got a lot of people in a cramped, warm environment. And if you look at the airflow of the building, it will invariably result in dirty air being taken over, being pumped through what was clean air and basically making the whole area dirty. Which establishments do you think should have clean air in certain places? Oh, hospitals. Our medic. I can guarantee that the way human beings behave and the way that our buildings are designed often means that even in those areas where we require critically clean air, that it's not clean. It works on various pressures, negative pressures and positive pressures, and it is a fascinating environment to watch. And the general premise is get the air out. It's really telling though, there's some brilliant piece of research that has turned that on its head in operating theatres. If you've got a highly contaminated piece in an operating theatre, you actually need to change the pressure system that you would have had to keep the dirty air in where you've got somebody whose body's been cut open. Because if you've got hazardous stuff coming out of the body, the last thing you want to do is then pump it into the rest of the hospital where nobody else has got the problem. Better to contain it and manage it than get rid of it. But we don't think of that when we do our design. So therefore, what do we do when we're thinking about the long-term health impacts on our people? We don't think about it. We don't think about how we should have measured and monitored and used technology to help us model how exposure might work or not, both physical and mental. So in that example of an airflow, particularly with AI now, knowing that construction is the second worst performing exploiting sector of technology, which is a shame because we're the one who could really benefit from it most. But if you now use AI to help model airflow in a building, you can now do exposure monitoring like that. When you then couple onto it a whole bunch of physical issues that we all observe, coughing, sneezing, spluttering, and that stuff can track that, you can now start to get a data overlay that says, hang on, my environment is behaving like this and I'm tracking the data. These people in this area of that building are coughing a lot. What does it mean? We've been working with a construction project using an array of technology to help monitor physical exposures. Dust. We can now track using area sensors when there's a rise in dust volumes. We can then switch the CCTV on to look at why that's occurred. I can then look at the personal sensors that they've got on that says, hang on, that person's exposed to it. I can then, a little big brotherish, but I can then look at the CCTV and see whether they've got their correct PPE on or not. So I now know that you are next to that lorry that's just come into the site that hasn't been damped down properly. It's done a handbrake turn, puts dust in the air, and you're not wearing your PPE. Now, that sounds very Big Brother-esque. But actually, what we're doing is demonstrating with technology the primary driver for enabling better health management of our people is good line management. A good supervisor would grip that member of staff for not wearing their PPE. They would have made sure that the site was damped down because they knew that lorry was coming on site. They would have told the lorry that handbrake turns are not acceptable. All these simple things we don't do because ultimately we're human. And the issue we have with being human is we are fallible. But the impact of being fallible is massive. And the data out there is really clear. The exposures that we see today, both physical and mental, may be with different hazards. So it may be COVID last week and it may be COVID 55 next week. But the hazard is still a hazard. And all of the policies, the processes and procedures exist for us to manage it properly already. The fascinating thing is it doesn't matter how much data organisations like mine, we're a charity, we keep finding the same lesson again and again and again, which is please apply the policies, the processes and procedures you've got and make sure that your line managers and supervisors do that. They do their job of line managing and supervising. Because ultimately, going back to the hierarchy of control, what's the best way for me to stop you getting skin cancer by working on a construction site? Is to make sure that it's eliminated as a risk from you. So how do I do that with you? Basics. But unsurprisingly, we've been told it for years. Put on a hat, wear sunscreen and wear a shirt. It's not rocket science. And yet when you look at the instances of skin cancer on construction workers, it's really high. Again, piece of research that we did proves it. So what am I saying? I'm saying no matter what health and safety and well-being issue you have in the workplace, there will already be a piece of research for it. I can guarantee it. It might not be specific to your piece, to your sector or to your industry or to your company, but it will be there. It sounds like I'm putting myself out of a job. That would make me so happy to be able to close IOM down, but I know that we live in a data-driven world. And common sense in the business world requires evidence, and it normally requires specific evidence. So if you do want some research done, I'll do it. But the real point for me is please learn those lessons from organisations like ours that have got 60 years worth of data and analysis that says, we can tell you where your exposure risks are, and we can tell you how to mitigate them. Even if those mitigations are not perfect, it will improve the place that we get to. We have to drive down, though, the real problem. And the real problem is to put health at the front of the agenda in your boardroom. Safety is good. Health, at this point, is dreadful. So my request to you is, if you take anything away from this, it's go back into your organisation and tell your board, encourage whatever phrase you want to use, that health is directly impacting your business today. You are losing people on a daily basis, whether that be through suicide, whether that be through cancer, whether that be through heart disease, directly attributable to work. Let's get it on the agenda so that we can move it forward and we can leverage the technology to help us do that. I'll happily take any quick questions now, but I've rambled on probably far too much. It's Matt's turn. Oh, it's Mark's turn.
Has anybody got any quick questions that they want to
Cool.
fire away?
Come on, Mark, all yours.